All right. Good evening, everyone. My name is Olutayo Sagunro. I am the founder of the platform, The Do Influence, where we try and educate and empower and influence people really along different career paths. We try and do a variety of different webinars in different subject areas. I happen to be a physician and surgeon as well. So a lot of the topics happen to also be health related. Hence why we have Dr. Tolentino with us here today, and really just whatever our audience kind of gives us a idea of what they want, and we try and kind of cater to that. So thank you so much for joining us today. I, without further ado, would love to introduce Dr. Jaclyn Tolentino. Dr. Tolentino is a board certified family physician with a collaborative, holistic approach to practicing medicine. She holds a subspecialty certification in hormone optimization and has received extensive training in functional medicine through the Institute of Functional Medicine and additional training in oncology and nutrition. She has a lot of interest, particularly in hormone balancing and optimization, which is something that her and I discussed a few months ago. And she has a really incredible story. And I'm sure she'll share some of that with you today, as well as why this is such an important topic. A lot of us women are waiting until later and later to have children because of our careers and things, and that's totally okay. I'm in that boat right here. So I'm just really thrilled that Dr. Tolentino is going to talk to us about some of those reproductive options and hormones and fertility today. Before we get started, I just wanted to take a quick poll just to see who we have with us today. Don't worry, all of these questions are anonymous. So if you have a question that you would like to ask, you can send it to me in the Do Influence in the chat, and I'll ask it anonymously at the end of the session. And all of the polls that we'll take are also anonymous. So don't feel like anyone's going to, be able to pinpoint who it is. All right. So I'm going to start with our first poll today. And it's just asking you, what age groups do we have in the audience today? I mean, I'm 21 and I'll be 21 forever, but for everyone else. Okay, great.
I love that, age 49 and above with more wisdom, of
Of
course.
course.
It's
All
great.
right. So here are the results. I think you guys should all be able to see that on your screen. So we have a little bit of uh, diversity of all ages, which is great. Oh, I forgot to put my 21 there. I'd be that one, the 21. Okay. All right. So I'm going to take that poll off. All right, Dr. Tolentino, I'm going to turn it over to you.
Okay, great. Let me share my screen. I hope everybody can hear me. If you can't, make sure that you let us know in the chat. And Olatayo, if you can pay attention through there, since I'm kind of going to be focused in on this presentation. And if this is a nice intimate setting, so I feel like this is great. If you guys have specific questions or you want to message anonymously, make sure that you do so. So let's play from the start. Can everyone see it clearly? Great. Okay, so here's how you find me. And this is also the company that I work for. I work for Parsley Health. We put out a lot of content, even through our social media channels and blogs and all of the different channels. So if you're interested in what we do and what we offer, I'll be speaking about that a little bit along the way. And this is also my personal email address. A lot of times I'll do these webinars and some people have additional questions. They are curious about the type of care, either from myself or other doctors at Parsley Health. We see patients in 48 states. So make sure that you jot this down in case that you want to connect further. For most of you, I am not your personal medical doctor. So all of the lectures, including this one in particular, are all for educational and informational purposes only. So this isn't specific medical advice for you in particular. Now, one thing that me and Olutayo had talked about specifically is making sure that if you have a question that feel like really applies to you, still go ahead and ask it, whether that's through anonymous, through the chat, or even at the end if we want to engage in dialogue, because we can also reframe these questions and just speak about generalizations on some of these topics. And I'm happy to answer those. So this is me. I am a senior doctor on the virtual team at Parsley, and Parsley is the largest holistic wellness practice that sees patients virtually and also in 2 locations on site in Los Angeles and also in New York. And we practice the type of medicine that we've tried to create this new model that really focuses on the root cause of helping people understand what types of conditions they have. It also marries advanced technology and the type of relationship that people are looking for with a clinician, where they can really engage in great dialogue and understand and educate about exactly what's going on with their health. I am board certified in family, and the specialty that I have in hormone optimization was really because I realized how important hormones are at every age. It doesn't matter where you are, at what age, hormones are always important, regardless of what age, because of how there's different fluctuations as we get older. So that was one of the reasons to engage in a specialty that really was supported by that. I am also a young breast cancer survivor. So in my early 30s, I was diagnosed, and I kind of talk about that a little bit more. And what's important there is that also drastically can affect a woman's chances of fertility or even the route or choice of fertility. So that's why this topic is really important, because I feel like even women that have had breast cancer or have had a family history or are concerned about how their fertility function is, it's important to be aware of these choices. And the more technology and knowledge that we're aware of as we get older, as the years go by, it's so great to be able to offer as much of this knowledge to others. So I was diagnosed back in 2016. So this July will be my 5-year cancer anniversary. So I'm really excited about that. Plan on having like a nice celebration there. And I was a woman who was also on birth control for several years. It was kind of one of those things where I kind of started when I was a teenager, and nobody really talked about getting off of it. And then I was just on it forever. And you kind of feel like when you would go see the doctor, they would just refill it for a year. And there wasn't really a lot of discussion about the types of impacts. There's lots of positives and some negatives. So it's worth bringing it up and making sure that I educate you on both of those. I had also done 3 rounds of IVF, and we're going to talk about fertility optimization and, this type of procedure, assisted procedures. And I did this prior to starting my chemotherapy for my breast cancer. I also follow that with a couple medications that really suppressed down my hormones, and that put me into a chemical menopause. So for any of the women that were in the 49 and up category, I know what it's like to be in a chemical menopause, very similar to what women experience at that age. And it wasn't fun. I was in it for about a couple of years. So this is a perfect opportunity for us to do this next poll. Should I stop sharing, or are you able to go ahead and do it?
Oh, sorry, I was on mute. You can keep it up. All right, we're going
Great.
to launch that first poll. All right. And these are our
Okay.
results.
This is great that we have this webinar. Since we're somewhat familiar, I want everybody to be very familiar by the end of this, right? And that may be something where we kind of like repeat this at the end. This is a good question to kind of do at the end. Thank you. Thank you for sharing. So now we have good context here. Okay. So today, what we're talking about, we're going to talk about birth control and what are the different options there. Talk just to give you some reflection points of what might be right for you. And then number 2, when's the best time to get pregnant? Sure, there's no best time, but there are a few things to consider when we're like trying to plan for pregnancy. And then infertility, when and why this happens for some women, and of course, what you can do about it. When we're talking about birth control, it's always important to consider your options. Certain things are going to work best for your body and your lifestyle. There's different types of options between hormonal and non-hormonal options. So it's important to understand those risks and benefits, and we'll talk about those in the upcoming slides. And then there's different kinds, long-term use versus short-term use. When you're using pills versus using things like an implanted IUD, it can be a little bit different, right? So there's implanted devices that are emitting hormone that they put in the arm as one example. And that's kind of a long-term solution, since it does take a bit to actually insert it and remove it. So it's important to think about, how long or how long and what type you plan on being on. And this might be different from the next woman. Hormonal birth control, here's what it is. Usually it's a combination of either progestin or estrogen and progestin. And there's 6 or so different types here. You've got the Nexplanon that I mentioned, where that gets implanted in the arm. You also have the pill, which is the most common form of birth control that we're all aware of. And then you've got intrauterine devices. They have ones that have hormone and also non-hormonal. Then there's the shot, Depo-Provera. I would say I feel like this was pretty common, at least when I was a teenager. And then there's the ring that's inserted. And then they also have birth control as a patch form. So here's like a list of the most common types. Here's some examples of some uses and side effects. So we use birth control mainly for contraceptive purposes. That's why that's listed the bullet point their contraceptive. And some clinicians will also treat hormonal imbalances with the use of birth control. Because with birth control, you're giving your body a finite amount of synthetic hormone. And that might be what a woman needs, depending on how her own natural hormone cycles are and if she's suffering from some conditions that are very severe. So for some women that have very severe hormonal conditions like endometriosis, sometimes some clinicians, OBGYNs, usually will put patients on hormonal birth control. That might be one option or one tool or one solution. And sure, there's other options to consider, but it's definitely worth noting. Most of the common side effects, many of us that have been on birth controls have probably experienced a lot of the first four, and maybe this last one on nutrient deficiencies. Okay. So spotting and bleeding, especially when you first start a birth control of any kind, breast tenderness, your body is also adjusting there. There's fluctuating levels of hormones that contribute to that. And then some women have digestive upset from the birth control pills. And sometimes the bloating sensation can happen. I documented gut dysbiosis. And what that is when the bacteria in the gut can sometimes overgrow or undergrow. Sometimes the bacteria in our gut microbiome, our gastrointestinal tract, can be affected if patients are on birth control. A lot of women get a lot of different headaches and migraines at different times of their cycle. And melasma sometimes can happen. I've had a few patients that have had issues with blood clots. So it's always important that if you are going to start birth control, you should always check to see with your family history, check with your parents to see if you've had any history of blood clots in the family, because this does need to be investigated first prior to you starting on a medication like this. Nutrient deficiencies, it's funny, it's at the bottom here, but I think that's one of the most common things I see. Here I mentioned a few of the micronutrients that are depleted commonly by birth control. The B vitamins are here listed. You can see vitamin C and E. What's important there is that a common side effect that you'll see listed on the label of any birth control is mood. It'll say, mood issues. A lot of women that are on birth control, they might have issues even with decreased libido and noticing like they're more irritable. And these vitamins that are depleted are often the ones that are really, really important, especially for mood. So oftentimes I'll recommend that a patient is on, a nice B complex that has all of the different B vitamins just to help replenish the body while they're on a birth control. Hope I'm not losing anyone, but we'll have time for questions at the end. So which birth control is right for you? I mentioned all 6 of the different kinds, and that really depends on your fertility goals. So some people want to use these devices. Some women are also learning a lot about their natural menstrual cycles and more effectively, when can they get pregnant? When can they not get pregnant? And learning about ovulation. We could do a whole webinar on top of this one that's really just focused on your period and just learning about it so that you know when you're more likely to get pregnant versus not. Sometimes that's a good starting point, just learning about your body and understanding what your menstrual cycle is like. And then I talked here about the long-term versus short-term. So is this a short-term birth control, or is this, something that you want in place long-term, as in months or even years, right? If we're trying to conceive in the next 3 to 5 years, some of these long-term options might not be a great solution. And can they always be reversed? Sure, there's possibilities to reverse this, but it's important to talk to your doctor about what this planning is going to look like for you in regards to when you want to get pregnant. And then for some that are not planning on having children at all, talking to your doctor about long-term solutions or, learning how to understand when you can and cannot get pregnant from your own fertility cycle. All of those things are important to consider. I think this is the perfect time to do the next poll before we talk about this slide.
Okay. All right, the poll is launched. Let's hear some of your answers and then we'll share them with the group. Remember, this is all anonymous. We'll wait another 10 seconds or so and then we'll end the poll.
Great.
Can you see the screen, Dr. Tolentino, the results of the poll?
Yeah, I can. So it's great that a lot of women are tracking their cycles. And for those that don't track, there's good reason and good opportunity to consider it. And then, tracking your cycle without tools, sure, it's absolutely possible to do that as well. That goes into depth for when women can start to notice changes in their discharge, cervical mucus changes, starting to time it to the cycle of even calendars. So I guess technically it's still kind of tracking by documenting that. So it's good to see that there's a majority of women that are learning to track their cycles. Thanks for sharing that. So planning for pregnancy. Let's talk a little bit about when fertility peaks and when it dips. Fertility typically peaks between late teens and late 20s. That's really the time period that our bodies are primed for pregnancy. And around age 30, this is when things really start to go downhill. And this decline is really sped up by around mid 30s. So you may have heard before, they're like, oh, if you're in your mid 30s, women have a tougher time getting pregnant. It's true that they do. And it is also true that starting at around age 35, those are also considered higher risk pregnancies, right? The number of eggs also decreases as we get older. So we're born with this nice abundance of eggs in our ovaries as babies. And as we get older, these number of eggs continues to deplete and deplete. So when people see a reproductive doctor, they usually talk about aging being one of the most important factors here when it comes to pregnancy and getting pregnant. Because as we get older, the number of available eggs continues to go down. Also, healthy couples. It's good to say that healthy couples in their 20s and 30s, 1 in 4 will get pregnant during a single menstrual cycle. So these are healthy couples that are trying to get pregnant. It's not like every individual out there has a hard time getting pregnant, but there are some women that do have this difficulty. And here you can see how much that declines. In your 20s and 30s, it's 1 in 4. And then when you're 40 and up, it's 1 in 10. And I would beg to differ that even when we're in our, 42, 43, 44, it's probably even less than that. Over here on the right, this is like a little picture of what's happening in your body when it comes to the different phases. Whenever a doctor talks to you about day 1 of your cycle, they're referring to that number 1 there where it says menstruation. That's the first day of when you're actually having the bright red bleed. And then all the way up until the next day 1, that counts the number of days of your menstrual cycle. Most women are going to ovulate right at around days 12 to 16, but not every single woman, and then of course during every single month, is going to ovulate at that time. And ovulation is the process for when one of the eggs matures in the ovaries and it gets released out of the ovaries through the fallopian tubes and into the uterus. So this is just a little picture of what's happening every single month for women. What to think about when you're trying to conceive. Did we complete all poll questions?
We still have one more.
Okay, why don't we do the last one?
All right. All right, we're launching the poll.
Thanks for voting. Good, so we've got some that are unsure, still thinking about it, majority there, and then others that are kind of thinking about it in 1 to 2 years. Good to know. So what to think about when you're trying to conceive in particular? There's a couple things that you should think about, making sure that you're priming your body to help get prepared for pregnancy. There are specific foods that are really going to be great to eat. Omega-3 rich foods, anti-inflammatory foods, antioxidant type foods. A lot of what we do at Parsley is to also help women that are really at this stage where they're trying to prime their body for pregnancy so that we have less side effects during pregnancy and we know how to navigate through any of the things that happen. Making sure that we're getting some movement in. Sleep is so important to help with the restoration process every single night, helping to balance out your hormones, helping to support your body's immune system, making sure that we find the right ways to alleviate stress. And sure, there's definitely some supplements that can be helpful for pregnancy as well. Oftentimes prenatals too have a multitude of different micronutrients that are great for pregnancy. And usually women will start taking these about 3 to 6 months prior. And if you are thinking about trying to conceive, hormonal birth control can get in the way. So deciding when to stop using this is really a good decision for you to have with your doctor. Some doctors, it depends on how soon. If you're trying to get pregnant within the next year, then stopping your birth control 6 months before might be the best time. Depends on how long you've been on the birth control. If you've been on birth control for 15, 16 years, maybe stopping it 6 months to a year prior would be best so that you can also help your body get back into the regular rhythm of having its own natural hormonal cycle. And a lot of that is the brain is signaling the ovaries to help produce a lot of these hormones and mature that egg. And part of that stopping that takes place is because of being on the hormonal birth control. So if we remove that, then we want to wake up the brain so it can start to signal the ovaries again. And I also put down to start tracking your cycle. And there's lots and lots of different ways to track nowadays. Just to even use one of the free apps on your phone, to just start to document exactly when you're having your period bleed and how many days you're having it. And also if you're experiencing any specific symptoms like excessive bloating or abdominal pain, or maybe your breasts are tender. So documenting these things are really great to discuss with your doctor. I find it helpful when I have women who are tracking so they can explain to me exactly what types of symptoms are happening in a regular rhythmic way. And that way we can talk about if that seems to be hormonally related based off of where they are in their cycle. So it is important to track since it's easy to gather some of this data on yourself. And working with a healthcare provider of some kind that has specific strategies to help support fertility optimization and preparation for conception, it's really important to get that on board too. You want to prime your body so that you're prepared for these types of situations. And then here's this option about, have you ever considered eggs or egg freezing? I mentioned that we would talk a little bit about IVF and IUI. So egg freezing, for some women that might not be ready, but they're thinking about it, like some of the women in the poll, and they're not sure about when that might be. And maybe if we pursued a career that has really like taken a lot of our time, maybe fertility is not like right at the top of the list, but you want to preserve that ability later. Egg freezing might be an option. And yes, it can be expensive, but it will preserve the quality of the eggs at the age from which you get them. So on average, the price of freezing your eggs can be expensive. And there are payment plans for this. There are different types of scholarships and things that are set up by different communities and organizations to help support women that are trying to save their eggs. And when you freeze your eggs, it depends on how many eggs they're able to get in one cycle. So it usually, when you see a reproductive doctor about freezing your eggs or thinking about it, they're taking a couple things into consideration. How old you are, what's the possibility of how many eggs that you're going to get? And then of course, finances and price is important because all of this takes a lot of medication, ultrasounds, labs, visits to see a fertility doctor. There's a lot of planning that goes into this type of a process. The purpose of freezing eggs would be to help support any thoughts of pregnancy in the future that maybe you're in your late 30s or you're 40 or 41. And by that time, the quality of your eggs isn't great, but it was great when you were 30 or 31 or 35. You can freeze those eggs and consider them for use in the future. So that may be one thing to think about, especially those that are also considering further education or with school, maybe in residency, maybe it's professional school, maybe this is just they're continuing to work and that's a priority, and maybe starting and building that family. Like Olatayo mentioned, maybe this isn't something that we were doing or thinking about when we were younger, but we're older and we're thinking about it. So egg freezing, it is something to consider. And I think that the benefits is just to have this as an option, right? So some women want to have some sort of an option when they get older and maybe their eggs don't have as great of quality and maybe they're having difficulty getting pregnant. So having these eggs frozen can be really helpful. A little bit about infertility and some basic reasons why this happens. So when women are trying to get pregnant and are having difficulties getting pregnant, I do see a lot of women that come to see me at Parsley Health because of that reason in particular. And here is just a short list of some of the causes, the most common causes and reasons why women have trouble getting pregnant. Remember too, when it comes to infertility or the inability to get pregnant, it's usually a couple things. It's not just the woman's side or it's not just the men's side. It's also, there's a third of cases that are also attributed to both what happens when the egg meets the sperm. So it's important to know that this isn't just the women or just the men. It can also happen when the egg and sperm meet, and that can also create its own set of issues. So here's an example of just a list. At the top here, you're going to see some things like PCOS, thyroid disorders. If somebody has anatomical abnormalities, even being over and underweight can also be a reason why women are not able to get pregnant. Primary ovarian insufficiency is your ovaries aren't producing enough of those eggs at a lot earlier of an age. So usually this is in the late 30s. In men, there is such thing as having abnormal sperm, and that includes the quality and the movement and the motility of the sperm and how they function. And there's easy ways to test these nowadays. So the way that you can even do testing for men, it doesn't have to be through a reproductive doctor. They have great labs that are using CLIA certified labs that do at-home testing, where you can check the sperm for the abundance, the motility, the movement, all of the markers so that you can see if sperm is healthy. One thing about men, they have an added advantage that sperm reproduces itself every 90 days. So they can clean up their diet, they can clean up, whatever it is. Maybe it's excessive alcohol, maybe they weren't exercising as much, maybe they had to focus on some chronic diseases, and that can totally change their sperm quality in about 90 days because their body is producing new sperm. Whereas for women, we're just born with that set number of eggs, and that number just continues to decline as we get older. So we don't get to have any new eggs. So unfortunately for us, we have this timing of aging, not on our side. So when should you see a doctor? It's important to note most couples will eventually conceive with or without treatment, but if we're looking for a guideline of when it's appropriate, if you're under 35, after 1 year of trying to get pregnant, then usually that's about the time that you would consider seeing a doctor about it. And if you're over 35, because of the fact that this is like that crux point for the aging of the eggs that continues to age and get older, if we're over 35, then we would consider talking to a fertility doctor in about, at least within 6 months of trying. And then if we're over 40, because again, aging of the eggs, it's important to talk to a fertility doctor as soon as possible. And here's what they do. On the right, they're going to take a look at the sperm counts. They're going to look for abnormal sperm. You can see in this picture, the anatomy has changed. And then we're going to also check for movement of the sperm. And a third of infertility cases can be due to men. They're also going to check the anatomy of the female. They're going to draw some lab work so they can assess what your hormones are doing and also help you understand ovulation so they can see if you're ovulating or if this needs to be supported. Both men and women need to be assessed. It's not like we would just want to assess a female. We also want to assess male partners as well. That's very important. I put this article here, and this is our website. So parsleyhealth.com is the website, and we have a ton of different blog articles on fertility, hormone health, estrogen metabolism, helping women understand PCOS, endometriosis, and lots of hormonal conditions. This is just an example of one article that we have listed there, but our blog has hundreds of articles, and we also cite research. So it's important for you to take a look there. You can even just go to the blog and Google the word hormone, or Google the word, or search engine the word infertility, and you're going to find that we have a lot of free information for anyone who wants to learn more about their bodies. So next steps. Reproductive health means working with a healthcare professional that you trust. And these aren't easy conversations. And sometimes, having the time to spend to talk with a doctor about what your struggles are or what you're concerned about, it's really important that you have someone to talk to. So finding a healthcare professional that you trust is really important here. And then learning what's normal in your body, tracking your cycles is a really important way to start things off. Knowing what your options are, long-term versus short-term use of birth control and which type is right for you. Also about how long have you been taking it if you're a woman who has already been on birth control for a while and you want to consider getting off and you want to make sure that your body is supported along the way. A lot of women also want to seek help just for that alone. Maybe you've been on birth control for quite some time and you're concerned about what might happen when you get off and how your body will react as it wakes up its hormones. So making sure that you have a health professional that you can trust to really talk about these things. And now is a time for questions. There's different plans at the company. Parsleyhealth.com is where I work. I'm happy to do any more presentations for you, Olatayo, if you find that to be helpful for this group. And if you have any specific questions, feel free. You can email me here. I'd be happy to respond and then just put this in the subject line. And that's all I got. So I'm excited to hear if we have any questions.
Thank you so much, Dr. Tolentino. That was an excellent presentation. And I think for people even that practice medicine like myself, it's one of those things that if you don't do it every day and you're not really in tune with it, this is a very good refresher for that. So thank you so much.
Of course.
I'm going to check our chat. I don't have any questions directly in our chat. What I was going to do was I just was going to open the floor up and just have people maybe just talk directly into the forum with your questions. We'd love to hear from you. while waiting, I'm going to ask you a couple, Dr. Tolentino. So, in terms of in vitro fertilization, now, can you talk a little bit more about that? Some women have a lot of fertility issues, even in their 20s, right? So we talk about fertility. Fertility is something that can affect women throughout their entire journey. Um, do you have a lot of women in your practice that are in their 20s that have been having a lot of issues with in vitro fertilization or just with fertility in general? And kind of really, this is more for those people who have tried in vitro fertilization and it failed. What advice or kind of hope can you give to them?
Yeah. So IVF is such an interesting thing because the reasons why a woman might have to resort to IVF might really be different for everyone, right? I was a woman who had gone through residency. And at that time, when I got diagnosed, it was kind of like in the crux of hard time in my career, really like working extra hard. And being diagnosed with breast cancer kind of like put the railing on me for fertility. So I really just had to like got forced into that decision. I very rarely see women in their 20s having difficulties getting pregnant. It is true that a lot of women can have early miscarriages. These things do happen for women actually quite frequently. But I see a lot more women in their 30s and even in their early 40s that are trying to get pregnant that are having a lot more difficulty. And that just really lends itself to the idea of the aging process and the aging cells, aging eggs in general, that happens as we continue to get older. The process of IVF, it is so grueling. It is grueling in every way, even from an emotional standpoint. I think what's tough about IVF is that nobody really prepares you for how intense the process can be. And there's no way to really know about what you're getting into until they do some ultrasounds and they do some labs and they're able to see what they see. And then as they see what they see, that will help them decide what's going to be the next course of action. And there's different types of medications that are used to kind of help support that IVF process. So for some women, they may be really successful. And in one round of IVF, they're able to get a lot of eggs that are coming out in one time. And other women might not be as successful, where the number of eggs that they're able to get in one round is a lot less. And so it's kind of like you feel almost like it's a crapshoot for what you're getting. And it's also an expensive one, right? Like this isn't cheap here. So thinking about it is even a tough thing to even fathom. Now, women that go through IVF in their 20s have a lot less difficulty with the number of eggs that are collected in one IVF round. Whereas a woman in her 30s, especially her late 30s, can have difficulty getting high counts of eggs. And even then, we're thinking back to the quality of the eggs that you receive in each IVF round.
Wow, very interesting. Thank you so much, Dr. Tolentino. I do have some questions. How does endometriosis affect fertility?
Endo is such a tough one. So, what happens with endometriosis is that there is this tissue that's developing on the outside of the uterus. That can be tissue that's developing outside of the ovaries. It can also be on the outside of the uterus, and it's starting to affect even the colon. So, some of these women even start to develop abdominal symptoms and digestive concerns, problems with stool and things like that, even problems with bladder. And what's difficult about endo is that when it has a lot of inflammation in those areas, it can make it difficult for the egg to release out of the ovary and into the uterus. Imagine if there's tissue outside of the uterus, then it could be inhibiting the way that those eggs are formed and way that one is coming out. Endo is a difficult one, and it does affect a lot of women that are trying to get pregnant and that experience infertility, which is why it's important to at least focus on how we can get control of the endo, which will then support better fertility. Another one that's also really common for women when it comes to infertility is PCOS. So that is also another really common reason why women are also not able to get pregnant. They're experiencing a lot of cysts on the ovaries, or they're experiencing some of these other symptoms that really point to PCOS. So helping to quell that, usually it's anti-inflammatory, either foods and supplements. It's also omega support. It's also making sure that all of the hormones are getting metabolized properly, that we're not producing too much estrogen, that we're eliminating out as much estrogen as possible so that we don't create so much of this excess. There's lots of ways to do that. And mainly it requires like a multifactorial approach.
Excellent. Thank you so much. Um, I have another question. So I'm just going to read it directly from the messaging. It's anonymous. It's a question about TSH ranges. Um, so a patient recently had a blood test and the TSH level was 5.09. The normal range stated on the form was zero point 0.3 to 4.8. So this level was above that normal range.
Mhm,
But her nutritional therapist uses narrower ranges.
mhm.
Her physician assured her that this is nothing to worry about and may be an anomaly, but the person asking just wanted to be sure.
No, that's a great question. So usually with thyroid stimulating hormone, when we're talking about fertility support, and there is a tie between having like good, well regulated or tightly regulated, as a doctor who practices integrative medicine, I like to see TSHs between 1 and 2.5. And it's not just looking at the TSH. You have to think about that gland, right? So the thyroid gland in our neck is responsible for our body's metabolism. It's also our thermostat. So women that have a sluggish thyroid that's not working well have a tendency to have higher TSH levels, like a 5.0, for example. And women that have this sluggish thyroid, the problem is that we can slow down the metabolism. So we end up with weight gain. We're also concerned about mood, anxiety, depression. We're also concerned about hair falling out much more than usual for women that are hypothyroid, and also fatigue being a really big contributor there. So when we're thinking about fertility optimization, for sure, there is a tighter reference range than the regular standard lab reference range that's really focused on that. So most fertility doctors are really trying to really tighten that to a TSH of between around 1 to 2 to 2.5. Even then, there's other hormones that are coming out of the thyroid gland. So that is just a signaling hormone. TSH is signaling from the brain to the gland itself. And then when it comes out, with the hormones that are coming out, there is measurements for those hormones as well. And the gland itself uses different foods and micronutrients that are coming from those foods to really help to support its function and help to nourish it, to make sure that all of those pathways are working properly. So we don't just look at just the TSH, we want to make sure we're looking at those other hormone numbers as well.
Awesome. Thank you so much, Dr. Tolentino. I believe someone in the audience has raised their hand. Miss Nicole, correct?
Hi.
Good evening. So I have a question. So I know many years ago, back when I was in school, when we talked about women's health, we kind of discussed at that time, 35 was kind of that magical age where if a female was on birth control, that was kind of that time period to maybe start easing off, just due to like the detrimental side effects that it can have as we continue to grow older. Is that still the case today, that 35 age, or has research changed? Is it earlier? Is it later? I only ask because I'll be 35 this year, and I guess I need to figure out what to do with my life.
Got it. Okay, so we're talking specifically for women that are on birth control up to 35?
Yes.
Yeah. So anecdotally, from what I've seen in practice, women that are on it up until 35, depends on how long, right? Say you were a woman who started at 33 and you were just on it for a couple years. It's not the same as those of us, like myself, where we were on it for like 15 years, right? So our body really got used to just having this set amount of hormone, synthetic hormone that's outside of the body, being put in every single day. And ideally, if we're still thinking about fertility to really optimize that support, I think that is a good age to consider getting off to prepare your body for pregnancy, right? If you're looking for a natural pregnancy. Now, some women, it depends on when they want to get pregnant. If you're looking to get pregnant in the next year or two, that's usually like that time period, like I mentioned in the PowerPoint, right? That you want to consider it. And then for some, it's just a matter of, I might not be ready to have a baby right at age 35, but I want to freeze my eggs so that maybe when I'm 40 or 41, maybe then I want to have a child. But then your eggs won't be great when we're 40 or 41. Even the process to even support like freezing your eggs, just that alone will require you to be off of the birth control just to even like do that process of the freezing. And it may take about 1 month of planning and 1 month of actually freezing the eggs. Then you could hop back on the birth control until you do decide that you are ready. But if we're thinking, yeah, maybe in 3 to 5 years, I'd want to have a kid, but I want to make sure that I have really good quality eggs for that child, then you would consider egg freezing sooner.
Okay. Thank you.
Yeah.
Thank you. And just to follow up with that, what about for women who don't necessarily aren't planning on getting pregnant ever, right? And they just have been on birth control since they were a teenager and they're approaching 35. In terms of birth control overall, I know you have the slides up with the risk factors and the risks associated with it. What do you recommend as an alternative to someone who's turning 35, is not thinking about getting pregnant or anything, but still wants to have some sort of, contraceptive?
Yeah. So it's tough. If they want to stay on birth control, that's one possibility. Knowing that it will deplete your body of certain micronutrients like the B vitamins and some of the ones that are important, like vitamin C and E and D, right? So making sure that you're taking a good multivitamin to help replenish what might get depleted there, and making sure that your gut microbiome is also protected. So making sure that we're eating like lots of whole foods, that we're focusing on pre and probiotics is great, so that we can kind of keep repopulating and re-inoculating the bacteria in our digestive tract that can get disrupted from being on the birth control for long periods of time. As far as options go, there's not a whole lot of options, right? So when we think about it, if a woman still wants to stay on the birth control because of the convenience, then it's important to make sure that they're still metabolizing out that synthetic hormone out of their body. That's where the exercise, the liver supportive foods, the B vitamin rich foods, the pre and probiotic foods are going to help make sure that their body isn't getting damaged from so long of birth control use over all of those years. So it's still an option and they can still consider it. For the ones that are like, look, I don't want the synthetic hormone in my body anymore, I want other options, there is the option of even understanding your own natural cycle. The window of opportunity to get pregnant is very slim when it comes to ovulation. There's just a set amount of time. So as women start to learn more and more about their menstrual cycle, some are using cervical mucus, some are using temperature regulation, some are using devices where you can actually pee on these little sticks and measure your hormone levels, estrogen, progesterone, and even luteinizing hormones, so you can see when your body is ovulating. And that's really helpful. And for some women, they're using these devices so that they don't get pregnant. They're actually using it for the opposite reason, not like they're trying to get pregnant. They want to know when their body is ovulating so that they don't get pregnant. They're like, this is the time that we need to make sure that we have added protection during sex. So some of these fertility and pregnancy devices are also used for that opposite reason of, hey, let me just learn my natural cycle. I don't want to be on any birth control, but I want to learn when I can get pregnant. And that's the time to avoid having sex or using extra protection during that time.
Wow, thank you so much for that answer. Another question for you is, does having surgery to remove scar tissue make it a little easier to conceive if a woman does have endometriosis?
It does. It does. It certainly does. And then, of course, really trying to slow down the growth of anything that's left over, any excessive endometrial tissue that continues to develop. And it's such a tough one because we don't know exactly why some of this tissue is developing on the outside of the uterus when it's not supposed to. We have some theories on it. There's some women that don't have a menstrual bleed that comes out of the vagina, but we think that some of that menstrual blood is actually coming out the opposite ends. And because of that, it's developing some of this tissue on the other side there. So having surgical clearance of that tissue can be really helpful. Imagine if you were a woman who had some of this tissue on the outside, but it was rubbing up against your bladder, and then you get pregnant. And then you're already, as the baby expands, you're already like getting up to go to the bathroom a lot, but then you might be experiencing a lot of pain to kind of like go along with that, right? So we kind of want to alleviate and take out as much as possible to kind of help support that. It's a good question.
Excellent, thank you. Another question for you. Do you notice a correlation between difficulty conceiving with PCOS and difficulty producing a full milk supply in the days, weeks, months after delivery? So basically PCOS affecting fertility and breastfeeding.
Yeah, so separately, two separate questions. I see a lot of PCOS affecting fertility just because of the fact that some women are really developing these cysts in the ovaries that don't have any support for like real true follicle, right? Follicle maturation, that where you can really ovulate an egg out. And so one of the hallmarks of PCOS is having these irregular menstrual cycle where you're not having this nice every 28 to 30-day cycles. And women that have PCOS have that difficulty. So really helping to get that under control, because it is one of the leading causes between that and endometriosis, two of the leading causes that are really tied to infertility in women, especially in their 30s and 40s. Separately from that, when it comes to breast milk, I don't see too much of an association between PCOS specifically. Even women that do get pregnant and have PCOS, sure, that absolutely happens and can happen. Same thing for women that have endo, you can still get pregnant. It just might make it a little bit more difficult, but that doesn't mean it's not possible. But for PCOS and breast milk, I don't commonly see that there's a lot of issues with that specifically. It might be unique to that individual woman, and that might be for a lot of different reasons. There are some natural herbs that are helpful to support breast milk production and stimulation, and even seeing like a lactation consultant about it can be helpful as well.
Excellent. Thank you so much. Just for some new people who joined us, we are in our question and answer session. This is recorded, so you will be able to review the lecture material afterwards. But we are talking about women reproductive health and fertility. So if you have any specific questions, feel free to ask them. A lot of people are asking questions anonymously, so you can just send your question to the Do Influence, which is me, and I will read it anonymously for you. And don't worry, I'm not remembering who sent me what, so don't worry. The next question I have here is this person, when they were 19 years old, and again at 23, they were diagnosed with ovarian cyst and had surgery. They remember having a very painful period, or that their periods were very painful. The person has a 13-year-old granddaughter who started her period a few months ago and suffers each month with painful periods. Sometimes she has to miss school. Is she too young to discuss her symptoms with the doctor?
That's a great question. Absolutely not too young to discuss those symptoms, right? For a woman who is younger, teenager, even like 9, 10, 11, and they're getting their period, they have a lot of questions. Their body is going through a lot of changes. And that is an important factor for that woman in particular, the one who's 13, to note that if this is a symptom that she's having that young, absolutely should talk to her doctor about it. It's true, the body is going to react as it's changing to starting to have these hormones in the system. But that's not the way women were supposed to have periods forever. We're not supposed to have these like intense, painful periods every single month. What we should be having is these very light periods where we don't experience an intense amount of pain, and they are happening pretty regularly. So it is so important that she talks to her doctor about it.
Excellent. Thank you so much. I've got another
Sure.
question here for you. So, um, this person wants to talk a little bit about some more about some TSH in their period. So, this person is not currently trying to conceive, but is curious and wanted to learn and thought this was a great opportunity to join and listen. So, yay. Um, this person's serum free T4 levels are 10.4, which they believe is a good thing and within the range. If the TSH is the only lab value that's out of range, what would you be why could that be? Like what would you think that would be the reason for that?
It's tough without getting some additional labs, right? Number one, we never just trust one single lab test. If a lab test looks off, we always repeat it. Another thing is there's other hormones that are coming from the brain. The TSH is one of those many hormones that are coming from the brain. So assessing not just a repeat TSH, but also assessing the other hormones that are coming from the brain so that we can see if there's changes in those ones as well, or if it's just this one TSH this one time. So it's always important to go back and retest and also take it into consideration by looking at other hormones that are also following that signaling pathway. That gives us a better understanding of, is this true that this TSH is off? Another thing is different labs have different reference ranges. I also like to test my hormones in the mornings. Hormones in the body are most abundant in the morning, especially after a really good night's sleep. So usually I'll have my women and then test the hormone levels right between, 8, 9, 10 a.m. at the latest, because that's really the best time to evaluate your hormones. When you check your hormone levels in the afternoon, 4 to 5 p.m., those aren't as accurate as they would be if they were consistently checked in the morning. So just another tip regarding labs.
Awesome. And now the second part of that question is just the person's periods are very regular, but the first day is out of this world in terms of pain, vomiting, and pooping. And after the first day, this person feels is a new woman. Any thoughts on that? And maybe why the first day is just crazy?
Yeah, I mean, that's pretty common that I hear about that a lot, right? Like really intense PMS symptoms, especially the first day. Sometimes it's even associated with crying because we're just like so emotional during that time as well. Right at that first day of the menstrual cycle, that's when all of the hormones are actually at their lowest point. We're talking estrogen and progesterone are like rock bottom when you test them. And then, of course, as we start to stimulate, as the body sheds that lining, days 2, 3, 4, 5, those hormone levels finally start to go up again, which is why we start to feel that sense of, wow, I feel so good. Estrogen is commonly tied to a neurotransmitter in the brain that's called serotonin, the happy hormone. And so this happy hormone is produced by the brain, but it's also produced by our digestive tract. So sometimes some of the symptoms that women have, especially right at that time of PMS, days 1 and 2, really have a lot to do with the fact that the hormones are at their lowest. And when you talk to your doctor, if you talk to one of us at Parsley, like absolutely, there are ways to kind of help quell that. Depends on what your lifestyle is like at that point in time too. How are we eating? How are we sleeping? Are we moving? Are we moving too much? Are we way too sedentary? All of those things are really important for the severity of PMS type symptoms. And there are natural herbs. There are ways to kind of help quell some of that and even help to support mood as well. Good
Um,
one.
can you list a couple of those?
Wait, which ones?
A couple. You said there are some natural herbs and things like that
Yeah.
that can help with those symptoms.
Yeah.
Hold on as I grab my pen.
Well, one of the first ones that I like is magnesium glycinate to help support PMS symptoms, right? So what magnesium is this wonder mineral that runs around 200 different chemical reactions in the body, but it is so, so great, especially since it supports relaxing muscles. So think about people, like even athletes, or even anyone really that wants to take like an Epsom salt bath and they start pouring in like cups of salt into the bath and they relax. They're trying to literally relax the muscles. Magnesium glycinate does exactly that. It helps to also relax the uterus. So there's also a lot less pain there. So that one is commonly recommended. I mean, totally, whenever it comes to these kinds of issues, you should be talking to your doctor about it so they can at least give you some advice. We have blog articles about PMS on our Parsley Health blog. We also have, like the full what we should be eating, how we should be exercising, the examples of different types of supplements, magnesium glycinate being the first one that I would try. Yeah, so there's lots of content there. You can check us out at parsleyhealth.com. And if you go to the blog and you just put in PMS in the search, you'll see a ton of articles on there.
Thank you so much. I've got another question for you. During your menstrual cycle, is it normal to have blood clotting?
Clotting. So clotting, we can have small amounts of clots, but if we're having like a lot of frequent clots, then I always think of stagnation, right? Whenever I think of clots. So it depends on how much, usually mild amounts of clots are really not a big deal, nothing to worry about. But if a woman is having a lot of excessive clots, then clearly that's something that needs to be investigated further. So if we're having like mild amounts during our menstrual cycle days, usually that's not a sign of anything worrisome. If we're having multiple clots every single time, you have a menstrual bleed every single day of that cycle, then it's important to have that checked out.
Excellent. Thank you. All
Lots
right.
of questions. I'm glad.
Yes. Are there any, I think if I missed anyone's question, please message me again in the chat. I think I got everyone's, but in case, re-message me again. But in the meantime, we'll open it up again, the floor again. If anyone wants to just ask their question directly, you're more than welcome to do that as well. But also you can message me as well. In the meantime, I'm going to send everyone the link to the Parsley Health blog directly to the blog. And I'm also going to send you the link to Dr. Tolentino's. Um, do you want
Follow along. You can send them to my Instagram if you want. I do a lot of like free webinars like this one.
do you want me to send them your Parsley one or your drtolentino.com one?
Either one. You can send them the Parsley one, and I'll just put my Instagram one in the chat. I do at least like 1 or 2 free webinars a month because I think education is so important and the right education should be free. So,
Absolutely.
um, yeah, so here we go. Let's see. Yeah. And I usually put like, whichever like lecture we have coming up and something in the stories, I usually do at least one, if not two a month. And I've done some on more specific topics like PCOS and endo and ovulation and period cycle 101 and just learning that. Some
Right,
things that they just didn't teach us.
right.
So it's so great. Thanks for having me.
Yes. So are there any last minute questions? This has been excellent. All right. Well, I thank you all so much for joining us today. Thank you, Dr. Tolentino, 100 times over. This was
Of
very
course.
informative. I appreciate your time and appreciate you sharing with us your knowledge and all the information. Um, I think Nicole, and I wanted to see if maybe she wanted to just say a couple words on behalf of her sorority, which all her lovely sisters, hopefully a lot of them joined us today. I know I'm throwing her on the spot, but just wanted to give you the opportunity to do that.
Good evening. Well, I want to thank you for, the initial invite. We were happy to come out today and support. I know for myself, someone who practices, a lot of this information was, I don't want to say new, but a review, because we get that health class back in, high school, and then it kind of just gets thrown out the window from there. You know what I mean? So I think it was a good review for women of all ages. And I like the topic too of how you discussed, childbirth into those later years in life. As women are, doing more things with their life. And like you say, making that decision to have children later on in life. So like I said, once again, thanks for the invite to collaborate.
Thank you. Thank you, everyone, for joining us today. And again, Dr. Tolentino, 100 times over. Thank you so much for a beautiful
Of course.
presentation. And this presentation is being recorded. If anyone is interested, I will post it on our website, thedoinfluence.com, under the section webinars. For other great educational webinars, feel free to check out our website under the webinars tab. Not all of them are health related. Some of them are really on different types of tools for really like self progress and self development, like time management and things like that. We do have some dedicated health ones, a women's health panel we did, a men's health panel, and there's a great breast cancer talk that I also did with Miss Nicole Crooks as well. So in case anyone wants access to those educational webinars, they're free on our website, thedoinfluence.com, under the webinars tab. And I hope to see you ladies in the future. Dr. Tolentino, we'll be talking some more. And
Of
I'm
course.
checking out your blog right now. So I'm going to be checking out some of those cool topics myself. So thank you so much. Everyone
You're
have a
welcome.
beautiful evening and stay blessed.
Bye. Bye.
Bye.